Defendant Placentia saw this as an opportunity to profit off of Mr. Perry. He wrote in a text message in September 2023, quote, "I wonder how much this moron will pay." He also stated in text messages that he wanted to be Mr. Perry's sole source of supply.
5 people have been charged in the death of actor Matthew Perry. 2 of them, doctors, accused of selling him the lethal dose of ketamine. Our 9 News medical expert, Dr. Payal Kohli, is joining us. We're going to talk about ketamine care. This is one of those topics that it is used safely in a hospital setting all the time, right?
Not only has it been used safely, it's been used safely for decades.
Yeah.
Yeah, so ketamine came about in the 1960s, and then it became popular in the 70s during the Vietnam War when they were using it out in the field. And it wasn't until early 2000s that we realized that in small doses it can actually have beneficial effects for depression, for treatment-resistant drug addiction, and for PTSD and other types of psychiatric issues. So in 2019, the FDA approved a nasal ketamine spray to treat treatment-resistant depression.
Small doses.
That's exactly right. Small doses under medical supervision. So this can be a drug of abuse. In fact, in the 80s and 90s, there were a lot of raves where they started realizing that ketamine makes you hallucinate. It makes you have out-of-body experiences. It makes you feel everything more because it heightens your senses. And so people started abusing it, which is why it's a controlled substance.
And it's addictive.
And it's not only is it addictive, Tom, you get tolerance to it. So if you're using excessive doses of it, you're going to need more and more of it over time to get the same effects, which is exactly what you're trying to sort of treat by using the ketamine in the first place.
This has to hurt as a doctor because these are doctors who, in theory, we hear about patients all the time who go doctor shopping. They want to find a doctor who will give them what they want. And he found him, but this is where first do no harm. This is where a doctor is supposed to step in and say, no, you need help. You don't need more ketamine.
Such a violation of your Hippocratic oath to protect patients, to heal, not to take advantage of their disease. And what really kills me is these doctors shouldn't have had ketamine in the first place because one of them was an urgent care doctor. The other one was an emergency room doctor. I mean, medical ketamine given to a patient for addiction or depression should be done under the care of a psychiatric physician. In fact, one of the doctors was training Matthew Perry's personal assistant about how to inject him to feed that addiction, so to speak. He even gave him a dose himself in his car.
Could they have known that this, or should they have known it was going to end like this?
They would have known. There is no other way this could have ended because you're needing escalating doses. In fact, the week before Matthew Perry died, this doctor even noted that one of the injections of ketamine gave him a very aggressive blood pressure and heart rate response. So when you inject somebody with ketamine, their blood pressure and heart rate gets stimulated. They can actually die from a very high blood pressure response. Of course, they have the visual stuff as well. I remember in medical school, the first ketamine patient that I saw getting anesthesia got ketamine, and his eyes went in different directions because that's how much it's scrambling your brain.
This doesn't speak poorly about ketamine, and this doesn't speak poorly about Matthew Perry. This speaks poorly about these individuals in particular, but also just generally how drugs like this are managed.
Yes, very much so. And I don't want this to mean people give ketamine a bad rep because it's great as an anesthetic and an analgesic. It works actually really well for patients who have heart disease because it doesn't cause a lot of the cardiopulmonary repression that some of the other drugs do. It works great out in the field when people need to sedate others. It works great out in the war field. And for depression, it's got promising uses. So using it in the right way, but just making sure that you're not pulling that trigger too easily because this is not one of those medicines first line, second line. It's the end of the line. When your depression is a threat to your life, that's when you're reaching for this. And what's really seductive about ketamine, it works within minutes to hours.
Yeah, that's what I read.
So it's not like other depression medicines.
It's an incredibly sad story, and it also makes plenty of people mad, too, as far as how it all happened. But we appreciate you taking a few minutes and telling us more, as always. Dr. Payal Kohli, thanks. You can always get more by going to 9news.com/Dr. Kohli and learn more about what the doctor is looking into.